shedding out. If pregnancy takes place, it's not going to be shedding out. Because the progesterone will keep them, hey, stay there. The new life is coming over there. But now, no baby is coming. So, this progesterone will be withdrawn and this will start shedding out. When there's a shedding out, then the glands and its ducts and the spiral arteriole and its branches all will be damaged, and there will be gradual withdrawal, and now it is this cavity filled in with the fluid, that is the blood and the other tissue fluid, and they will start going out through the cervical canal and finally in the vagina, and it is going out through the vagina outside. Okay, so this is called menstruation, and it is due to the withdrawal of the progesterone, because the pregnancy is not taking place, so progesterone will go down. It is going out. Why it is going out? Okay, make it going out. When it is going out, only the tunica basalis is there. Only the mother cells are there. And these mother cells will produce again tunica functionalis. And every month they are doing this same kind of business. Okay? So definitely, if you want to measure the thickness of the endometrium, then you need to ask, when was your last period start? So according to the phase of the cycle, the thickness of the endometrium varies. The highest thickness starts from the ovulation time to onwards. Okay, so we measure from here to there, outer to outer, the AP, the widest part, okay, the height. But if it is proliferative phase, if it is secretory phase, and if it is just period or just after the period, then you will see this thickness varies. And this thickness usually, averagely, 1 centimeter is normal. But I got 1.3, 1.4. It's normal too. During the whole period is normal. Maybe less than 1 centimeter is normal. As long as patient has no complaint, no signs, symptoms, so it is normal. Okay? And there is a appearance called triple stripe. Triple stripes that forms in the endometrium because of okay, I'm just making it just dotted for you. triple stripe. So in the center, this is the closing status of the endometrial cavity by the endometrium. That looks like a bright echo. So this is one, and this is one. This is called triple stripe. When you see this triple stripe, then you need to understand that this woman is going to be ovulated soon or already ovulated. So in that way, you can assess, you can ask the woman, that when is your next period due? The girl will say 12 more days or 2 more weeks. And then you can easily understand the patient is in the day of 14 plus minus 2. Okay? So now you understood that during period what happened. Now, during proliferative phase, what happened during proliferation? The endometrial tissue will be growing more and more and more and more. Endometrial tissue. Okay? Just think about the endometrial tissue is growing more and more. That is proliferative phase. And the in secretory phase, you will see that lot of blood vessels and glandular tissues and their ducts are there in secretory phase, and it looks like a double bed, big cushion, okay, in secretory phase. So now I will draw the diagram of the uterine or over menstrual cycle with the ovarian cycle and the hormones. Okay, and their hormones. Let's see. Good. So, okay, so this is 14th day. This is 28 plus minus 2, and this is 0, and this is 5th day. This phase is known as period, the menstrual phase, and this phase is proliferative. And this phase is secretory phase. Secretory phase. Okay, so now I'm drawing that what happened, the endometrial condition during this 3 phase. Okay, if you look carefully, then you will say in the secretory phase there are blood vessels, there are glands all over, and these are the proliferation of the endometrial tissue. Endometrial tissues. So now look at here, during the period the tunica functionalis is shaded out, only the tunica basalis is there. So this is tunica basalis. Tunica basalis. And then stimulation to proliferative phase. So now this period is due to the withdrawal of progesterone. The decrease of progesterone, and this proliferation is due to the estrogen. And this estrogen is coming from the ovaries. Okay, this estrogen increase, and this secretory phase, increase of progesterone, and decrease of estrogen. And here the estrogen is increased and progesterone is decreased. We need to remember this. This menstrual period is due to the withdrawal of the progesterone. The proliferative phase is influenced by the estrogen coming from the ovaries. At that time, the progesterone is low because the ovulation did not take place yet. Corpus luteum not yet produced. After ovulation, corpus luteum is there and the progesterone level is up. When the progesterone level is up, estrogen levels goes down. Okay, so now I like to show you with the chart. So this is estrogen, and this is progesterone. Okay, let's see what happened. So estrogen during the proliferative phase, estrogen will go up. This is the peak of estrogen. Okay, peak point. And during this, before the ovulation, what happened? The progesterone. Okay? The progesterone goes down. After ovulation, that is the secretory phase, the estrogen will go down. Estrogen, and now progesterone will go up. Okay, so this is the chart. So this is progesterone and this is estrogen, and at this time, because of the peak of the estrogen, luteinizing hormone will increase and the ovulation takes place. As soon as the ovulation takes place, the corpus luteum is produced and the progesterone goes up. Okay, so this is progesterone, the purple color, and the red color is estrogen. So now understand this concept. It is very important to understand. During this period, there will be decrease of progesterone, and the proliferative phase, the estrogen level is going up. Estrogen level is going up. During that time, progesterone is decreased because there is no corpus luteum. As soon as the ovulation takes place, corpus luteum is there, the progesterone level is going up. Okay? And the next cycle will start, so then it will be decline again like this. And the progesterone level, estrogen level will decrease. Why decreased? Because no more Graafian follicle is produced at that time. So follicle stimulating hormone is not present at that time. This is the time for corpus luteum and progesterone. So in the secretory phase, two hormones are there. Progesterone is high and estrogen is low. Before the ovulation, estrogen is high, progesterone is low. If you remember this sequence, one is high, one is low before ovulation, after ovulation, reverse. Okay? So, if I draw that diagram, so the primary follicle is now getting bigger, Okay, it's a Graafian follicle. At that time, follicle stimulating hormone is produced and it helps the primary follicle to be Graafian follicle. So this is primary follicle and is a mature follicle. And this maturation produce increase estrogen. Okay, so now ovulation took place, the egg is released, the egg is released, and the Graafian follicle is present. Okay, so this is Graafian follicle and this is post-ovulatory cycle, that is that corresponds with the secretory cycle, and the Graafian follicle will increase the progesterone and as there is no follicle maturation after the ovulation, so estrogen level will go down. Okay, and this increase of progesterone depends on the